Hi, Nurse Hallie. I'm here to give you the handoff report for our patient, Mary Lou. She is 20 years old. She experienced about 8 days ago a stroke, which affected the right side of her brain. So she has left-sided impaired mobility. She was transferred to rehab about 4 days ago from the hospital. Before hospitalization, Mrs. Bradley was healthy. There were no major health concerns. Her husband found her passed out in their home, called the ambulance, and she is now here with us. She has no other known medical illnesses, as I just stated. She's around 5'4", weighs about 170 pounds. She is Catholic, and her support system includes her mother, her husband, and sister, who are usually here every day in the room with her, just helping her out. Her home medications include an oral birth control, drospirin, alpha-estradiol daily. And then upon talking to her, she just expressed feelings of grief and sadness over being her young age of 20 and having a stroke that's severely impaired her life. She said, to quote her, "My arms and legs are not mine," and she just made it very clear that she's clearly upset by this. Her vital signs were stable. She didn't have any pain last time we were talking to her. She expressed a want to go to church, so I think it'd be important to see if we could get a priest in here just to talk to her and give her a little bit of comfort in that sense. And then for her, she's a fall risk of 4. Her last, because she cannot get out of bed without assistance, so she needs assistance. And because of that, her fall risk is at a 4. I just said that. Her last bowel movement was yesterday, and she is urinating on the commode. My recommendation is to maintain PT and OT, which she goes to daily, and then encourage emotional well-being through friends and family, and just increase that support, and then just take vitals, neuro, and psychosocial exams again later, and then I will give you her meds. So she has 2 scheduled routine drugs. The first one is Doxit sodium. It's 100 milligrams by mouth daily at 0900, and the other one is aspirin, and it's 160 milligrams by mouth daily, also at 0900. And then she has 3 PRNs. One is ibuprofen up to 104 milligrams by mouth every 6 hours, and that's for pain and fever discomfort. Bizacodil, which is 1 to 2 tablets by mouth daily as needed for constipation. Make sure she just takes it with a tall glass of water. And the other one is calcium carbonate, which is 1 to 2 tablets by mouth. Max is 15 tablets per 24 hours. And I think that is it. Do you have any other questions?
What are her motor functions like?
Motor functions are impaired. She has no fine motor skills. She needs assistance everywhere because of that. She is making progress in PT, but she stated she's obviously not to the area she wishes she would be.
Any cognitive impairments that you've noticed?
No cognitive impairments that we've noticed, just like expressing emotions of anger and sadness towards not having the control like she normally would.
And she's awake and alert?
She is awake and alert.
All right, sounds good.
Okay.